Hi, everyone. My name is Olivia, and I'm the Patient Support Manager at Trajectory. And today we have Dr. Lebow with us, who's going to be discussing about how the coronavirus is impacting patients and some things that we can do to better ourselves during this time. So we're going to go ahead and get started. And Dr. Lebow, can you tell me what type of physician you are and how this virus is directly impacting your practice?
Hello, Olivia. My name is Dr. Lebow, Dr. Max Lebow. I'm board certified in both emergency medicine and preventive medicine. So the COVID virus affects me both in my daily practice as an ER physician and an urgent care physician, as well as my public health background helps me better understand some of the steps that have been taken to decrease the curve and the infectivity of coronavirus within our population.
Okay.
We've
Sure.
seen a number of patients with COVID, and I've treated many of them, and I'm beginning to get a feel of the history of from the first day to the end. And a good thing to say is that some patients I'm releasing now back. They've finished their treatment and they're back at their jobs after having had the COVID virus. So that's, I think, very good news and something nice to think about.
Yeah, definitely. So can you tell me a little bit about some of the risks for specifically for cancer patients from the coronavirus?
Well, in most cases, the risks for patients who have cancer are the same as people without. That is, that keeping a safe distance of 6 feet, called social distancing, as well as hand washing and all the other preventive care. The National Cancer Institute has put out some guidelines for doctors about how to think of the COVID virus for patients with cancer.
Mm-hmm.
The main thing to remember is that in general, the risk is about the same for people with cancer and without, but is dependent mainly on the stage of your treatment. So for instance, if you're actively being treated with chemotherapy, therapeutic agents, or you're in a clinical trial, that's going to affect your immune system.
Mm-hmm.
So that would generally put a person at a higher risk. That just means that you should practice better social distancing, more, and be mindful of all the steps to try to mitigate the virus in your own social circle and your own house, and as you self-isolate yourself.
Okay, thank you. That's really helpful. And then what type of symptoms should patients be aware of?
There's 3 general symptoms that we think about with the COVID virus. The first is a dry cough. Most patients get a dry cough. It's not like the cough of a cold. Generally, when you have a cold, it's very mucousy. Most patients with COVID virus start out with a dry cough. You might feel like you have to bring something up, but nothing is coming up. The second thing is a fever. Other patients, the first symptom they get is they will wake up with a high fever. The third thing that we see very often are muscle aches, and patients complain sometimes of being sore all over. Some people get a headache. Some people get backaches or pain in their large muscles like the thighs. And finally, what's almost universal is fatigue. Our patients get fatigued, they get very tired, and they feel like they talk about being it's hard to lift their arms because their arms feel heavy. And these are universal signs of COVID that you should look for And if you do think that you have some of those, you will want to call your doctor, period.
Okay. So if someone is experiencing these symptoms, then they should call their doctor. What other things would you recommend? Should they stay at home, or what would be
Well,
best?
there is no treatment for the COVID virus. The current recommendations are as follows. If the symptoms that we discussed, with a fever, temperature, muscle aches, fatigue, if you have those symptoms, generally speaking, you should stay at home, self-isolate. The symptoms generally will start several days after an exposure, generally about 3. For most patients, they reach their highest point at about 7 or 8 days, and then they begin to get better after that period. The things for most patients, staying at home is all that you'll need to do. And we will talk a little later about what to do when you're at home. However, there are some danger signs, and here are the danger signs. The things that get patients in trouble with COVID are, first of all, difficulty breathing. The COVID virus does seem to like to go into the lungs, and that is a place where we're the most vulnerable. So if you get short of breath, now a cough is expected, but a shortness of breath on very limited activities or at rest is a danger sign, and you should call your doctor. The second thing to watch out for is a few of my patients have had their most prominent symptom has been GI distress. In other words, vomiting and diarrhea. If you have diarrhea, generally you can replace that with fluids, and we'll talk a little bit about what kind of fluids in a minute. But if you're vomiting and can't take fluids, and you feel like you're getting dehydrated, in other words, your lips are dry, you're not using the bathroom every 4 to 6 hours, which is what I generally recommend to my patients. You should be drinking enough fluids that you're going to the bathroom every 4 to 6 hours. If you're getting dehydrated and you can't keep fluids down, then that's an excellent reason to call your doctor. And remember, if they're very severe, such as we described with shortness of breath, don't be reticent. Don't hesitate to call 911 and go to the ER, where you will be treated with supplemental oxygen and be evaluated at that portal to the healthcare system. But for most patients, and this is including patients with cancer, most patients will do well. They'll get over the disease. And the good thing is, once you're over it, you won't get it, at least this year. We don't know about next year, but at least this year you'll be okay.
Okay. So that was kind of going off to my next question is, when should cancer patients presenting with symptoms come to the ER? You had said it's more for respiratory. What other symptoms?
Well, the most important is respiratory, and if you're short of breath on limited activity. In other words, if this is how, here are some of the symptoms of shortness of breath. And if you're a caretaker of somebody who has COVID or with cancer and COVID, the things to watch for are inability to finish a sentence without taking a breath. That our sentences are about as long as we exhale and can complete a sentence. And most times we don't need to stop in the middle of the sentence to get a breath. But if you find that you're doing that, or someone you're taking care of is doing that, that's a dangerous sign. Getting up and going to the bathroom and some of my patients say they get up, they go to the bathroom, and they're very tired when they finish. And that's pretty normal. However, if you go to the bathroom and come back and you're winded, you're short of breath, you feel like you've run a marathon, not because you're sore, but because you're panting, that's shortness of breath.
Okay.
Other things to look for, and you probably won't see this in yourself, but a loved one might see it, or someone who's helping taking care of you. If your color gets poor, generally speaking, the pink color of our skin is well oxygenated blood. One of the things that happens when we can't breathe is our skin starts to get a little pale. We'll get bluish around our lips, and we may not notice this ourselves, but someone may notice that for us. And finally, as I mentioned, intractable vomiting, inability to keep fluids down. It's very important to keep well hydrated during the COVID virus, or any virus, or most all infections. Hydration is very important. And if you can't maintain hydration with drinking water or things like Gatorade or chicken soup or whatever you like to get your fluids down, then that would be a reason to consider going to the emergency department.
Okay, thank you. That was very informative. So we're going to go ahead and, start wrapping up here. So I want to kind of end this by, I want you to tell me what are some key takeaways for patients during this time. It can be very emotionally and physically difficult for our bodies. We're not used to being isolated. What are some good and helpful things patients can do?
Well, that's very true. And I want to leave our audience with some things to think about. Many of us are in isolation, including myself at this point. And there's certain steps you can take to stay healthy and engaged, even while you're in isolation and during this difficult time. And here are some of the pointers to take away. First of all, get up at the same time that you would every other day. Set your alarm clock. Don't use this as a vacation, and your internal clocks will start resetting. And you want to get up in the morning. Don't stay in your bed clothes. Get dressed. If your job generally starts at 8, or you generally start at 9 o'clock, get ready, get dressed, feel yourself. Women put on makeup, men shave. Make sure that you're following a routine. The next thing to remember is that our muscle tone is maintained on a daily basis. We may not realize it, but those of you who have a step counter will know. In our daily lives, we may put in 5,000 steps. When you're at home, you should maintain some sort of exercise, either organized, or if you have steps, if you can't do steps, walk around your apartment. Keep your muscle tone. It's okay to go out. There's nothing wrong with going in the outside. Now, I take walks. I make sure that I'm going at times and places where there's not a lot of people, but I walk on the sidewalk or by the curb. If somebody's coming, I sort of keep my social distance, and I get my exercise every day. I can tell you that that it's just like we hear about the astronauts who go to space and they lose their muscle tone within a couple weeks. That will happen to us too. So that would be my next pointer. The next thing I would say is naturally eat healthy. I've heard of people complaining that they're gaining weight when they're at home in isolation. Don't let that happen to you. One of the things that I'm doing is trying to eat fruits and vegetables for lunch. I keep a light lunch, fruit and vegetables. Then at dinner, I'm nice and hungry. I get a good meal, and I'm maintaining and drinking lots of fluids, maintaining nutrition, maintaining hydration. So those are the things for self-isolation. And I just want to say a few words to maybe bring some light at the end of the tunnel. And it's very early to say, and who knows when the exact date. But as I said earlier, there are thousands of patients who are now who have had COVID. I wish the news media would talk more about this. Who have had COVID and they're now back at work, totally done. I can tell you, they're all very happy. They don't have to worry about themselves getting infected again. We don't know the exact the immunity that you have from the virus. Is it going to be like seasonal flu where we will get it this year once, we could get it next year, or would it be more like measles where we get it once and then we're covered the rest of our lives? We don't know that yet, but we do know that once somebody has it, they should be okay for at least some time. And finally, there's lots of resources. Keep yourself, remember the basics of social distancing, washing your hands. And one of the things that I always tell people about washing your hands is most people wash their hands, they wash the palm of their hands, they lather up, and don't forget the tips of your fingers. The tips of your fingers is what's touching people. Wash your hands, scrub your fingertips into your palm after you've lathered up. Make sure your fingertips are clean under your nails. That's where germs seem to like to stay. Those are important things. Don't touch your face more than you have to. Remember, these germs enter through our nose and mouth. Even though they talk about the virus can be alive on a surface, it's not going to jump off the surface in most cases into you. It's going to get from the surface by you touching it and then touching your face. So avoid touching your face. And I think if you do all those things, people working very hard on treatments, vaccines. I think by next year we'll have a vaccine. So let's all try to get through this as best we can, support each other, and we will, and I'm hoping for the best for everyone. So good luck to everyone. And if you have any questions, certainly you can submit them to Olivia and I will try to answer them if I can.
Okay.
Thank you all. Goodbye.
Thank you, Dr. Lebow. It was so great talking to you.
Thank you.